Karthik from Find Facts has been giving all updates about coronavirus in detail, and so in this video, I'm just going to summarize all that you need to know about coronavirus. Coronaviruses are a large family of viruses that typically attack the respiratory system. Signs of infection include fever, cough, shortness of breath and breathing difficulties. In most severe cases, it can lead to pneumonia, SARS, kidney failure and even death. The total number of the people infected with the virus rose more than several thousands across China. Chinese health authorities are still trying to determine the origin of the virus, which they say likely came from a seafood market in Wuhan, where wildlife was also traded illegally. Chinese scientists previously mentioned snakes also as a possible source. The WHO also says that an animal source appears most likely to be the primary source of the outbreak. Chinese officials recently said that the virus had a 96% concordance with an already known bat-borne coronavirus. Even though very little is known about the virus, it is confirmed that it can be transferred from one human to another. So when an infected person coughs or sneezes, they let out a spray, and if these droplets reach the nose, eyes or mouth of another person, the virus can be passed on. In some cases, it is possible to spread indirectly through touching the droplets on surfaces and then touching mucosal membranes in the mouth, eyes and nose. That is why hand washing is an important public health measure at all times, and especially in an outbreak. The incubation period of the coronavirus remains unknown. Some sources say it could be between 10 and 14 days. In China, the infection is more widespread than SARS. Most cases and deaths have been reported in China. Countries and territories that have confirmed cases infected with coronavirus are India, Thailand, Japan, Hong Kong, Singapore, Taiwan, Australia, Malaysia, Macau, Russia, France, the United States, South Korea, Germany, the United Arab Emirates, Canada, Britain, Vietnam, Italy, Philippines, Nepal, Cambodia, Sri Lanka, Finland, Sweden and Spain. Cases recorded in Thailand, Taiwan, Germany, Vietnam, Japan, France and the United States involved patients who did not travel to China. In total, more than 150 cases have been reported in countries other than China. Countries around the world are taking efforts to tackle the new coronavirus that originated in China's Wuhan city. In the past few days, Russia and Singapore have sealed their borders to China, and the World Health Organization declared the outbreak a global public health emergency. Meanwhile, the US government issued its highest-level travel advisory, quarantining 195 citizens evacuated from China and temporarily banning foreign nationals who have recently been to China from coming in. The World Health Organization declared a global health emergency over coronavirus that has killed more than 400 people in China. This outbreak forced a government lockdown in almost 20 cities in China, and this has stopped the movement of people and goods in order to stop the virus from spreading. Chinese authorities have sealed off Wuhan, and 56 million people in China are quarantined. The name coronavirus comes from the Latin word corona. Corona means a crown. As we saw earlier, more than thousands of coronavirus cases have been reported worldwide. Most of them were in China. A man from Wuhan died in the Philippines on February 2nd, becoming the first death outside of China. The infection is more widespread than the 2002-2003 SARS outbreak, which also originated in China. According to the World Health Organization, coronaviruses are a family of viruses that cause illness like common cold to SARS and MERS. MERS is Middle East Respiratory Syndrome. SARS was first recognized as a distinct strain of coronavirus in 2003. The source of the virus have never been clear, but the first human infections can be traced back to China in 2002. The virus then became a pandemic, causing more than 8,000 infections in 26 countries with close to 800 deaths. MERS was first identified in Saudi Arabia in 2012 in people displaying symptoms of fever, cough, shortness of breath, and occasionally gastrointestinal problems such as diarrhea. An animal source for the virus has never been officially confirmed, though there are studies that prove that the MERS virus was transmitted to humans from a camel. The World Health Organization identified around 2,500 cases of infection in 27 countries since initial breakouts, resulting in nearly 860 deaths. Coronaviruses were transmitted between animals and people. SARS was believed to have been transmitted from civet cats to humans, and MERS travelled from camel to humans. MERS did not spread widely, but it was more deadly, killing 1/3 of those infected. Scientists are working on a vaccine for coronavirus, but it will not be available for mass distribution before the year 2021. We already saw that China is in a complete lockdown because of the virus. Many airlines have also cancelled flights to China, while some countries have banned Chinese nationals from entering and have also evacuated their citizens from Wuhan. After the first cases of human-to-human transmission outside China were confirmed, the World Health Organization announced a global health emergency. The International Health Alert is actually a call on countries around the world to coordinate their response under the guidance of the United Nations Health Agency. There have been 5 global health emergencies since 2005. Swine flu in 2009, polio in 2014, Ebola in 2014, Zika in 2016 and again Ebola in 2019. China has designated 27 hospitals and 2 other new hospitals in Wuhan for the treatment of coronavirus. China has also asked the European Union for help in buying urgently needed medical supplies from its member countries. The director of World Health Organization was very clear that the health emergency was raised as a precautionary measure. The agency has also called on the international community to help in countries with weaker health systems. If the disease continues to spread, it could turn into a pandemic, but there are a few ways to end this outbreak. Public health measures should identify the infected cases fast and put infected people in isolation. This will stop the spread of this coronavirus. That's what stopped the spread of SARS in 2003. When infected people are kept in isolation, like a fire burns itself out, a virus outbreak will end when it stops finding people to infect. So there's the possibility that the virus will die out. I again repeat that the WHO's declaration of a public health emergency of international concern does not mean that we are facing a deadly pandemic. It is a political tool that the agency can use to draw attention to a serious disease threat. It is meant to engage the global community in a coordinated outbreak response, organize resources, give countries guidance on how to react and stop the disease from spreading further across borders. In case the infection becomes pandemic, the effect would likely be harsher in some countries than in others. While wealthier countries can direct their resources toward early detection and treatment, countries with fragile healthcare system will not necessarily be able to offer the same level of care. As there is no vaccine for coronavirus to help prevent the infection, we should do the same things we do to avoid the common cold. Wash hands thoroughly with soap and warm water or with an alcohol-based hand sanitizer. Keep your hands and fingers away from eyes, nose and mouth. Avoid close contact with people who are infected. Get plenty of rest, drink fluids, take medicines for sore throat and fever. A humidifier or steamy shower can also help ease a sore and scratchy throat. When one gets sick and if the symptoms gets worse or don't go away, a doctor should be consulted immediately. This on the whole is the summary of the coronavirus disaster. Stay connected for more such information. This is Nisha PS.